Well, I'll get us started. Welcome to our session on health impact assessment as a tool for communities. I'm Rebecca Ruggles. I'm the director of the Maryland Environmental Health Network. And I have been fascinated by learning how health issues can be used to put a human face on the environmental problems that we're all concerned about when we're concerned about environmental justice. We've been saying all weekend is the intersection of people and the environment, but it's not all people who are equally affected. And so health impact assessment is a wonderful tool for figuring out what are the specific health effects that a specific group of people are going to feel if we go through with a specific plan. So it's a tool that's designed for application to a specific plan or problem or policy. I want to introduce our speakers, but first I want to let you know a little bit about how we're going to do the session. We are going to have two presentations, and one will be a little bit of an overview on health impact assessment, and another will be more of a specific case study and how health impact assessment was part of a work that was done in DC. Our first speaker is Katie Moat from Baltimore City Health Department, and she has Anna with her. Anna, I forgot your last name. Anna Berry with her colleague, and they will be giving the overview on health impact assessment. What is it? What are its component parts? And then maybe describe a little bit the work they've done using it. And then our second speaker is Jana Phoenix. She is a professor at George Washington University, a physician, and the founder of the DC Environmental Health Collaborative, and she's done work using a health impact assessment with the Benning Road community, very concerned about the work that Pepco is doing on a site right near a residential community. I want you to know that what we'll do after those two presentations, we'll have time for question and answer, of course, but then at the last section of our time together, we'll actually be doing an interactive exercise. So you'll be able to take one of the tasks associated with health impact assessment and try it out on a problem either of your own choosing, or we'll give you some suggestions of specific problems. So we'll maybe form into smaller groups of 3 or 4 or 5 and do some interactive work together. Up here we have a couple of resources that you're also welcome to take before you leave. This is a paper by the National Academy of Sciences calling Improving Health in the United States, the Role of Health Impact Assessment. This is a resource list that we put together of a bunch of websites and reports that you can look at. And I brought with me, just to illustrate to you what these health impact assessment studies really look like, this one, which is one that was conducted in Baltimore, in a neighborhood that was being affected by a rail facility that was new rail facility that was going to be built. And this was published in September of 2013. And I'll pass it around so you can have a look at what they did. It's the National Center for Healthy Housing that worked with the Morrill Park community. Unfortunately, the member of leadership of the Morrill Park community who was going to be joining us, Mary Bush, is not joining us. Mostly my fault because I didn't follow up with her because I was trying to coordinate too many things. So I'll pass that around. That is my file copy, but you can get that online, and I have the link to it. I also wanted to show you another report that I picked up. I'm very interested these days in how goods movement and the growth of our ports is affecting communities in port cities. And so I happened to go and take a tour of the Port of LA, and they passed this report out to us. It's called Democratizing Planning, How Communities Are Raising Their Voices to Transform the I-710 Corridor Project. This is a highway expansion project in LA. And what's interesting is that in this huge project, one of the tools they used was health impact assessment to help them design the proposal for the port that they wanted, that the community wanted, rather than just reacting to the proposals that the Port of LA and the Port of Long Beach and the California Department of Transportation were going to impose on them. And then lastly, I'll call your attention to this document, which is really easy reading, and it's like a guidebook to HIA, Janet identified this as a resource. It's called a Guide for Health Impact Assessment. It comes from the California Department of Public Health, and I have a copy of that up here, so if anybody wants to see it, you're welcome to do that. So with that, I will invite Katie to come up and start us off with her presentation. Thank you. Katie and Anna, excuse me. Katie and Anna.
Okay, hi everybody. Thank you for coming out today. We're really pleased to be here and excited to share with you just some background information on health impact assessment as a tool. We don't have as much information about our own work in here because it hasn't been as environmentally focused as I think Janet's work has been, but we can talk more about that with question and answers afterwards if you're interested. So as Rebecca mentioned, I'm Katie Moat. I'm the Health Impact Assessment Planning Coordinator for the Baltimore City Health Department, and this is Anna Perry. She's an AmeriCorps Vista service member with us for this year. And before we get started, I'd like to acknowledge Keisha Pollock from the Johns Hopkins Bloomberg School of Public Health and also the Health Impact Project for sharing a lot of the following content that we are including. First of all, how many of you have previous experience in HIA? Anybody? That's okay, great. That's wonderful. So this will be, this is kind of just a really brief introduction, and we're hoping to spark that interest, and then you can, use some of the resources that we have available to continue learning about it and seeing if it's applicable to situations in your own communities. So as I'm sure many of you know, there are many factors that contribute to our overall health and well-being, from income, access to healthy foods, and the environment. And these are only some of the many factors that make up our overall health. In fact, genetics, healthcare, and personal behaviors account for less than half of our overall health and well-being, while social and environmental conditions account for 55% of our overall health. And so with these social determinants of health in mind, we recognize that many decisions that have health impacts are made in non-health sectors without considering the unintended negative health impacts that will be taking place in communities. And not only the impacts, but also the distribution of those impacts within the community. Recognizing that certain populations might be affected more so than others, just based on other factors. So some groups may hardly feel an impact of a new intermodal rail facility, for example, whereas others potentially living closer to that area or have fewer resources might really feel the impact a lot more. So health impact assessment aims to address this issue by determining the potential health impacts of proposed policies, plans, programs, or projects, and it uses a systematic process with an array of data sources and community engagement tools to determine the health impacts and the distribution of those impacts. The bottom line is that HIA is a practical way to collaborate across sectors and agencies and translate public health research into predictions and reasonable recommendations that decision makers can use. So it's important to note here that HIA is really meant to be used for proposed policies or projects, things that you still have an opportunity to change, things that you can still impact through the recommendations so that you're being proactive and you're not reacting to something that's already happening or that's already, causing these negative impacts. So HIA addresses the determinants of health by studying the proposed project and how that proposal will affect elements such as housing, air quality, nutrition, access to transportation, water quality, all of those kinds of determinants of health, and then eventually how those changes will lead to health outcomes. So HIA can be used in a variety of sectors and can be used on a variety of different kinds of projects. So it's kind of a universal tool as long as whatever you want to look at is a proposal and is not already implemented. So energy, agriculture, built environment, policies, projects, plans, programs, any of those are fair game as long as there's an opportunity to impact the ultimate implementation of the project. There are 3 types of HIA. And this really has to do with the scope and the resources available when you are completing the HIA process. Rapid or desktop is usually can be done in a matter of days or weeks and involves a lot of literature review and existing data that you kind of apply to a proposed project. Intermediate and comprehensive involve more community engagement, more primary data collection, and just kind of becomes more comprehensive as you have more resources or more time, or if the project just allows or needs that extra, input and data collection. And, some comprehensive HIAs can take as long as 2 years to complete. So there are many distinct values to conducting an HIA, and HIAs involve a broad range of impacted people in order to achieve meaningful cross-sector collaboration, and it also allows harms and benefits of a proposal to be determined and potentially addressed before a decision is made or a project is implemented. It uses a variety of evidence-based strategies and increases the transparency of the decision-making process. So I think one of the key benefits of HIA is that there is that opportunity to actually change the proposal before it's implemented. If you have the right people at the table from the beginning, so including people that will eventually be making the decision, including the affected communities, those are all things that can strengthen the process so that when you do have the data in front of you and you can come up with the recommendations that would help address the negative health consequences while also maximizing positive health consequences, that's one of the real strengths of the HI process. So the HI process involves 6 main steps. These are screening, scoping, assessment, recommendations, reporting, and then monitoring and evaluation. During the screening process, the need and value of an HIA is determined to make sure it makes sense to do an HIA on a given project. This is when you would look at what resources available, what your time frame is, whether or not changes to the plan can actually be made. If the person who is making the decision or the people who are planning to implement the proposal are not at all open to making changes, then does it really make sense to do an HIA if nothing will come from it? Maybe it still does. Maybe that's information that you want the community to have so that they can continue to advocate for themselves, given this very data-driven kind of research. But then also if maybe your efforts or your resources would be better somewhere else if there is no chance to make a change. The scoping step determines what impacts or what portion of the proposal will be studied. So in some of our previous experience, we're looking at these giant kind of plans for the city of Baltimore and just recognizing our own limitations. Sometimes we have to pick a very specific part of that plan to study. Which is kind of another benefit of HIA, that it can be that adaptable and you can kind of apply it to parts of things as well as entire plans or projects. The assessment step provides a profile of existing health conditions and an evaluation of potential health impacts. And this is where, again, that distribution of health impacts is really important to consider. Looking at the affected populations, what are the differences between all of those populations? How will they differently be affected given the changes that the proposal would have on the community? Oops. And then recommendations are crafted after the assessment step to mitigate any potential negative impacts while maximizing positive health impacts. This is kind of looking at the data that you get through the assessment step, connecting it to the existing literature from other places that have experienced similar projects. What are ways we can mitigate those negative health consequences we don't want to see in the community? The results of the HIA are then drafted into a report and shared with affected communities and decision makers. And then hypothetically, the impacts of the decision are monitored for their impact on health outcomes over time. Unfortunately, that is the hardest step. I think, as all of us know in this kind of work, that is the hardest step to really achieve, because funding sometimes is so tied to completing the HIA process, but then you don't have funding for the studies years down the road to see what the change really was. So I think that's definitely one of the weaknesses of the project or of the process, but I think that's the same for any number of assessment tools. So that's something that we're aware of, and we are trying to figure out what is a good way to kind of mitigate that challenge. And one thing that we have tried to do, so Baltimore City does kind of community health assessments every so often, associated with other projects or whatever, and as much as we can, we try to kind of connect those assessments with previous work that's been done on HIAs so that we can see if there are tangible effects or tangible benefits from the recommendations that were made and the changes that were made to the proposal down the road in those communities. And I think community engagement is the kind of underlying really key part of the HIA process in all of these different steps. Community engagement is crucial in every single one of those 6 steps, especially in scoping and the recommendations. Scoping allows us to really learn about the community's priorities and the community's concerns for the project, and what they're worried about is going to happen in their community, so that we can focus on those things and address those things as much as we can. And then in the recommendations as well, we try to connect the data that we have through the assessment back to those community concerns and figure out what are the best ways we can mitigate those negative impacts. So according to the Society of Practitioners of Health Impact Assessment, there are 5 main principles of HIA. And these are democracy, equity, sustainable development, ethical use of evidence, and a comprehensive approach to health. All of these principles are meant to ensure the integrity of all HIA work. And really, I think overall, this means that you're including the community from the beginning. You're getting their input on what they think is important. You're kind of bringing them to the table so that these decisions that maybe sometimes are made without any community input can be made so that the community is aware of what's going on, and then they can also contribute to the process. And again, community engagement is kind of what makes HIA different from other assessments. It ensures that the HIA is a participatory process with stakeholder engagement at every step. It brings public health professionals, community stakeholders, planners, developers, and policymakers together at the table with a focus on practical, realistic solutions. And it can ensure a more democratic and transparent decision-making process. And throughout our work and the work being done throughout the country, there are several lessons learned that I think are important to share with you today. HIA adds the most value when it's not already part of the decision-making process. HIAs are not necessary for all proposed projects, and sometimes it might be sufficient to apply existing information to a proposal without using valuable resources to complete the entire HIA process. It's also important to recognize the differences between health and planning priorities in order to maximize the impact of HIA outcomes, and recognizing the differences in language between public health and other disciplines can also save time and energy down the road. When you know how other groups of people refer to the same thing that you call one thing in public health or in environmental work, kind of incorporating that into the report and into the process from the beginning can make sure everybody is on the same page all along, so you're all speaking the same language. We've run into that, I think, before, where we really are after the same goal, but we're talking about it in completely different ways, and it causes a lot of confusion. So if you can kind of create a common language at the beginning, I think that's really important. And this is a map put together by the Health Impact Project, which is a national organization working on HIA, and also the Centers for Disease Control and Prevention's Healthy Community Design Initiative, that shows, as of February of 2014, the number of completed and in-progress HIAs that have been reported to these groups in the U.S. I know it's not comprehensive. I know there are several in Maryland that are not up there. I think a lot of ours aren't actually included on this map. But it just kind of gives you an idea. I think in the last maybe 10 years, this has just really exploded. I don't think that, there were definitely maybe only 20 or so done in the U.S. in maybe 10 years ago. So more and more people are recognizing the benefits and are using it on local issues, statewide issues, and even federal issues. And this shows the topics that HIAs have addressed. So of the reports that are included on that previous map, this is kind of the distribution of the topics that they're looking at. As you can see, the built environment and transportation make up more than half of the group, but also natural resources and energy make up a significant portion, as well as education, economic policy, so that they can be applied to so many different things. And I think more and more traction is being put to apply HIA to kind of non-traditional subjects, things we wouldn't traditionally think of, having a health impact or being able to study in this way. And then, as you would expect, I think a lot of HIAs are done by government agencies, but also nonprofits and educational institutions, I think, are also becoming more and more involved in this process. And it's interesting, I think that nonprofits and educational institutions also are sometimes at an advantage because they can have maybe more of an honest opinion, or can maybe voice their opinion or voice what the study actually shows without worrying about the repercussions politically. They can sometimes be a little bit more open with what the findings show. Not that we are always open with what our findings show, but we just have to be a little bit more politically sensitive because we are a government agency. Now, Anna will talk more about the environmental side of HIA and how it can be integrated into existing practices.
Yeah. Okay, so looking now at how to incorporate HIAs into the policy process, it's important to consider some of the challenges you may face. So the policy is not a linear process. You may not know at the beginning what your timeline will be with the decision with either the health impact or the environmental portion. Health is only one of multiple factors that you would have to take into account. So looking at how health works with all the other various factors may be complicated. And also logistics is a challenge. So looking at who's going to complete this HIA, who'll be paying for it, and then which communities will be most affected surrounding the policy and how to best engage them. The implementation of health impact assessments are a relatively new field in the U.S. The Environmental Protection Agency did a study that found HIAs are being used more frequently now, but mostly at the local level. So some HIAs are being done at the county, state, and federal level, but not as many. So one idea that would work to bring HIAs into the policy landscape would be to connect it with a policy that's already in place. So NEPA would be a great idea. This is the National Environmental Policy Act, established in 1970, and it established the need for environmental impact assessments. And if HIAs were regulated through this law, it would likely lead to standards being set for HIAs and more of an opportunity to provide capacity and funding. So HIAs aren't currently required as part of any environmental policy. NEPA requires a health analysis that goes along with their environmental impact assessment, but it's not as comprehensive as a health impact assessment would be. And a lot of EIAs done now don't really include as much of a health analysis as they were expecting when they established it. And it's not very well enforced, so it's often inconsistent or incomplete. Also, when this portion of the EIA is included, they may take into account things like the risk of getting cancer, asthma, or other health risks instead of a broader range of health impacts, which would look at the built environment, social determinants of health, or the economic impact for the surrounding communities. So just in case anyone doesn't know what an environmental impact assessment consists of, it's used by many organizations, governmental, public, and private. The purpose is to protect the environment by identifying effects of the proposed policies and projects. And they have a similar process to the HIAs that Katie went over before. And although EIAs were on the policy landscape before 1970, that's when it was established as mandatory by NEPA. So as you saw on the last slide, there are similarities between conducting both the environmental impact assessment and the health impact assessment. One of the most important portions of an HIA is the community engagement, and there are a lot of steps in the EIA that also gets community input. So this would be an easy way to integrate both the HIA and the EIA if you already have that practice in place. Also, the HIA would sufficiently meet the need of the health analysis portion of the EIA. So just some things to keep in mind when conducting the HIA as part of an EIA. It's important to determine the appropriate scope of health effects. So looking at both the health risks, which are like the risk of cancer or asthma that I mentioned before, but also bringing in built environment, social determinants of health, etc. It's important to make sure to identify all the communities that will be affected and engage them properly, and important to analyze the health effects in a way that's scientifically and legally defensible through the requirements of NEPA. So if you're interested in how to either integrate EIA and HIA or just more generally HIA, these are some great resources that we use. The Health Impact Project, Society of Practitioners, and Health Impact Assessment, Centers for Disease Control Prevention, Healthy Community Design Initiative, and Human Impact Partners. So we can take some questions now, but if you have anything afterwards, this is our contact information. So does anybody have any questions?
I have one question. Is that somewhere where we can access it online?
The slides?
This PowerPoint, the slides?
I think we were talking earlier that hopefully it will be, but if not, feel free to contact me and I'd be happy to send this to you as well.
Okay.
And I can give
So
you my
either one
card
of
Or you
afterwards.
can go
Yes.
through me if you
Yeah.
want to get to
Yes,
know.
Yeah.
I am dying,
Yeah.
and I don't know how, and I'm
Yeah.
real excited, and
Yeah.
hoping that I can
And as actually, I
work
mean,
my way
this is a
through
small
this.
enough group, would it be okay if we went around and kind of learned where people are from?
Yeah,
Sure.
I think that would be a great idea,
Okay.
actually. Do you mind if we do that before we
No.
transition to your session? Are there other questions just burning on your tongues before we do the introduction?
And I know that was kind of fast, but, you know, so
I'm
anything.
just curious, has there been any movement for proposed legislation that you're aware of, locally, state, federal level, to try to make this part of the decision-making process?
So I don't think locally or at the state level for Maryland. I know in some other states there has been more movement. I think in Massachusetts there's been some movement on transportation projects there requiring HIA. But a lot of times, and this is the tricky part, they end up being unfunded mandates, which is, it's great that, it's in the legislation, but how do you make it happen when there's no money attached?
Yeah, New Howard County, I thought it was a state mandate that every county did one.
Really? I don't know.
Because I know Howard County, well, they said it was, our local health improvement.
Not a health impact assessment,
Yeah.
because you'd have to specify for what. It's a tool designed to evaluate these specific proposals, so it can't be mandated without defining the what.
Yeah.
Well, I guess the what was specific means for the work of health improvement coalition.
Oh,
So I know the Horizon Foundation and Columbia Association, a couple agencies in California.
But again, it kind of loops back to, how, if there's a way to integrate it into existing requirements, so through EIA and NEPA, that might be a wonderful opportunity to make it a little bit more mainstream and a little bit more utilized by a broader group of people. But also, we don't want to make it into a kind of bureaucratic layer that just has to get done and it loses its effect or it loses its value. So that's kind of a fine balance, and I think we're at the point where we're trying to figure out how do we keep this moving forward,
And it is actually part of the requirements in Canada and the UK and a couple other countries in Europe.
Yeah.
I think it's a bigger, yeah.
Sure. Does anybody else have questions?
go ahead.
Okay, I don't want to, but I have a lot of questions.
Okay.
Okay, the Baltimore City Health Department, you actually have a coordinator for that within the health department.
Yes.
Does every state have that?
No, and so and I can explain, I'll give you a little bit more background on our program. So we had 3 years of funding from the Centers for Disease Control. It is coming to a close now, and we are wondering what will be the future of HIA in Baltimore City. I think, we see the benefit of it and we want to continue it, but it's just a question of money, which is, I think, unfortunate, and I think it's a problem for everybody, I'm sure. So no, most places don't have an HIA coordinator. I think it's being incorporated into the work of some people's jobs who are kind of built environment and public health coordinators, like those kind of mixed roles. But yeah, I think it's, on one hand, it's nice to have a coordinator that kind of works on HIA solely, but on the other hand, it might make sense to try to incorporate HIA into the regular job functions of existing people in buildings.
Okay, another question. You said nonprofits, they actually get in touch with you at the health department and call you up and say, look, this is, happening. Can you help us by doing a health That's actually how it happens?
I mean, there's a variety of ways it can happen. So I think on that map, the nonprofit would be the ones actually conducting the HIA. So on that
Okay.
graph,
So
would
they
be
would
the
get
ones-
in touch with you for the,
Potentially, so, you
For
know, like, so
statistics
for
or
example,
something like that?
the Morel Park HIA,
Mhm.
I think they came to us for some data, but we
Right.
were not involved otherwise, and that was before I had joined the health department, but we were not otherwise involved in the conduction of that HIA. So, you know, it can be a variety of different players involved and things like that.
so in other words, as a nonprofit, I could go into like Delaware, call their health department and say, you know, look, I'm looking to do something
Yeah.
on this. Can you give me statistics for this county or this?
Yeah, so I mean, I think it varies state to state, jurisdiction to
Right.
jurisdiction, what they can provide to you, but I know with us, we are, you know, usually more than willing to help provide that information to groups that are doing that kind of work. But also, you know, one of our struggles has been knowing what projects we should be focusing on. So we've had funding to do three HIAs per year for 3 years, which is a lot, and I don't recommend taking on that many. But just knowing what those projects should be has been a struggle. And so the more that, you know, other individuals and other organizations can get in contact with us to let us know about projects that are, you know, being proposed in their communities, the better. I think,
Right.
so that it's on our radar and on our, we can keep track of it. Other questions? Sure.
Just in my community, when they built the incinerator in Lurton,
Uh-huh.
they said that they were going to have air quality monitoring. And it was the health department that had the air quality monitoring station. Then the health department had budget problems.
Yeah.
So of course, they had to eliminate the air quality. But I mean, I was just wondering, does the health departments, do they get into air quality? Because now in my area, they don't want to talk about air, you know what I'm talking about?
Right, absolutely. I think again, it depends place to place.
Oh.
For us, that's come up in the past, and that's kind of a state level function.
Oh.
It's not something that Baltimore City has the capacity for as much as the state would. But that's something that I think we've included in some of our reports in the past, that it should be done at the state level if that's where the capacity.
Oh, on the state level?
Yeah. But I think it varies from state to state, whether it's at the local or state level.
I wanted to put this website up on the screen, because if I could get in, which I was, this is the Health Impact Project of the Pew Charitable Trust and the Robert Wood Johnson Foundation. And they have a inventory of a lot of, this is the map of all the projects that have been done. And then you can actually do the list view. I was just doing this the other day, and you can
Yeah, you can
say that you want to see, let's say, agriculture is the, and maybe you want to do it at the county level, and you want to see the ones that were done in Pennsylvania, perhaps, huh? Or let's do Maryland. I don't know if any will come up, so maybe that's not a good idea. Maybe I should say all, and all. So we could look at all the Maryland ones that come up, and then you can get a little short blurb on them, and when you click on it, so here's Baltimore City's comprehensive zoning code rewrite. Did you mention that while I was tuning
No.
out? And so there's a whole page on it, and it tells you how it was funded, who did it, and what its status is, and it gives you a link to the report that came out if it was made public. So you can get a lot of, examples of real life ones, and see what people learned and how they applied them.
Yeah, and I think it's fascinating, this resource as well as Human Impact Partners. Human Impact Partners, I think, has a tendency to, or has in the past kind of applied HIA to non-traditional topics. So they've done a lot around economic legislation and things that, you wouldn't normally think of, like a built environment or an environmental project.
So I'm not familiar with the HIAs at all, so I think I'm struggling a little bit about the actual process.
Uh-huh.
I got the impression that it's something that anyone can do when you're talking about nonprofits, so where's like the qualifications or the peer review?
Sure.
That
And
whole
that's,
aspect of
it's
it?
such a new tool in the US that is something that I think is still being built. So the Society of Practitioners of Health Impact Assessment has kind of put together minimum requirements to do an HIA, and they're hoping to be able to better peer review as things come out. So that I was going to mention the map that she pulled up from the Health Impact Project. That's anything anybody self-reports as an HIA. So it, as you look through it, I'm sure you'll see things that, oh, I don't know if I would classify that as an HIA, or I'm not sure I agree with their research methods, or, so that's something to keep in mind. But again, I think that as we move forward and as it becomes more and more used, those standards will become more important, and, the quality, I think, overall will improve as people become more aware.
If I could just add a comment. One thing that was very helpful to me when I was beginning to put together a team to do the HIA that we did in DC is that we went to the conference that was sponsored by Pew. And they do it, I think, every other year. And there's another one coming up in a few months on health impact assessments. And it's going to be in DC, and it's fairly reasonable, the registration fee. I think it was about $150. But they pulled together basically a lot of the people who've done work in this field in the U.S. and also in other countries. The field is much further along outside the U.S. than it is in the U.S., so Europe and Canada are much farther along in terms of the expertise. So a lot of those people were called in to conduct workshops. But it's growing. There are a lot of people, that map has filled in a lot in the last 2 years. But that's a great way to get kind of the Health Impact Assessment 101, very concentrated. And you'll leave that knowing what to do with resources. You will have talked to people who've done them, gotten their cards and email addresses, and they're happy to help you kind of figure out how this could be done in your own community, what you would need to do in terms of pulling a team together. It's really a great primer.
And it's interesting. I went to the National HIA meeting that was held last September, I believe.
Yeah.
And and then I was also at a conference out in Oakland over the summer, or actually this September maybe, that was held with the Human Impact Partners Group and Sophia. And you really feel like you are part of this kind of beginning of this kind of becoming a more utilized tool, and you can kind of shape what that looks like, which is kind of a neat experience. I wanted to pull this up before Janet speaks. This is the minimum elements and practice standards for health impact assessment from the Society of Practitioners, and this is kind of, I think at every conference they kind of take another look at this and see what's changed, what needs to be adjusted, what's working. And they try to hold each other accountable to meet these standards through the HIA work, which is something that I think, again, will just become more and more used as it grows. So I'll leave these up if people are interested afterwards.
I passed out this piece because it has on page 3 the 6 steps with a little cheat sheet about what those are. So that might be just useful if you're still trying to get your mind around what do you do, what is the step-by-step approach. And I also have here on this sheet, which I'll pass out since we're a small group, the link for the that conference that Janet just mentioned is coming up in June this year.
And I have it up here
a
as
link
well.
for that.
I pulled up the website as well.
And you pulled up,
yeah.
yeah, thank you so much. So as well as just a few
One
I'm sorry. Just pick up enough. So the map is at the Health Impact Project. Health Impact Project. And if you type in Health Impact Project and the rest of that, it takes you, the first thing that comes up is the right site. And then you get that compendium of all the different types. I was looking at them recently for a group called Choose Clean Water Coalition to illustrate that this is used for waterfront development, stream restoration. A lot of classic environmentalist projects you can enhance community buy-in by saying, and if we do this, here's the benefits to our community's health. And in the project that I mentioned, just to say a little more about this before we transition to Janet's example, these people in LA, they were starting out completely in reactive mode. These are the communities of South LA and Long Beach who are very affected by highways that lead to the Port of LA and the Port of Long Beach. And they were completely in reactive mode to the presentation of a proposal to expand the highway, a 4-lane highway, to be an 8-lane highway, because that's how we're going to service the port when it grows. Now that we're having these huge container ships coming over from China. And the community was able, through the use of HIA, to turn that around and turn it into a proactive conversation. And Katie highlighted that HIA is a tool for being proactive. This was not a done deal. It was a decision that hadn't already been made. By doing the HIA, they were able to come up with something we called Community Alternative 7. And the result was no widening of the general purpose lanes, a mandatory zero emissions corridor, a public-private partnership, river improvements, comprehensive pedestrian and bicycle element in the plan, etc. So they just changed the terms of the community, industry, government conversation.
It's amazing.
In part by using the tool of HIA. Now, they did a lot. This was 10 years of organizing. If you're interested in this example, I'm happy to share that report around. So why don't we transition, Janet, to you? I found out that these bios are not available to everybody. Is that correct? So I will read you Janet's bio
Should I pull up my
very briefly while you're bringing that.
Okay, sure.
Can we do that? And I would assume Jen will get access to this information. So Janet Phoenix is an assistant research professor in the Department of Health Policy at George Washington University School of Public Health. Dr. Phoenix manages Breathe Easy, an asthma home visiting project for Breathe Breath BC, a nonprofit organization dedicated to lung health. Since joining the Department of Health Policy, she has worked on child health issues. Dr. Phoenix was the recipient of a Health Policy Fellowship from the Robert Wood Johnson Foundation. And during that year, she spent her time working on healthcare reform. She's served on 2 federal advisory committees, the Center for Disease Control and Prevention's Lead Poisoning Advisory Committee, and the EPA's Children's Health Protection Advisory Committee.
Rebecca, that's probably
It's enough.
Yeah.
But most important thing is that you're the founder of the DC Environmental Health Collaborative, which is the reason you're going to be telling this story.
Exactly.
Okay.
Okay, so I want to talk a little bit about the health impact assessment that I was involved with organizing and pushed for, and to be honest, it's still underway. Although we did issue a preliminary report about 1.5 years ago, we're still working. But I think it's a good example of some of the ways that a health impact assessment can be used to improve the community's ability to have an impact on a proposed policy or a proposed program. So, all things are local, so sometimes you have to dive into the local to really get an understanding of what the big picture is all about. So for this community that I had been working with as part of the DC Environmental Health Collaborative, we'd had a series of listening sessions and had compiled kind of a short list of environmental health issues that were important to people in these Northeast and Southeast Washington neighborhoods. A lot of the issues had to do with children's health, but this issue of toxic exposure kept coming up over and over and over again, but in different contexts. So it came up in terms of the Kenilworth landfill, which was an old landfill facility that sits pretty much smack dab in the middle of the neighborhood, which ceased receiving trash and ceased being an active landfill within 1 year of the federal regulations that would have mandated some improvements and would have mandated a cap to guard against methane releases and would have really turned that facility into a different and more environmentally friendly facility. So the plant kind of closed down right at that time, so to avoid that kind of regulation. And then there was the Washington Navy Yard, which is also, again, within 1 mile of all of the neighborhoods who are involved in the collaborative, which had been declared a Superfund site. And for years, the Washington Navy Yard had been dumping some things that no one even really knows what they were into the Anacostia River, which runs through the neighborhood. And then there are 3 or 4 other sites that I won't go into a lot of detail about, but then kind of, and right smack dab in the middle was this coal-fired power plant, which had been in operation since 1903. And really, it was part of the landscape of the community. I mean, you can't really drive through Northeast Washington without seeing the power stacks. And if you've ever ridden the Orange Line, then you really, the Orange Line goes right through, practically right through the plant. I mean, it's right on the border. You know, you could practically toss a stone out of the window if you could open the window on one of the trains, and it would land in the yard of the power plant. So the power plant ceased operating as a coal-fired plant in 1983. And then, so it operated as a gas-fired plant for many years, and then a year and a half ago, they ceased the active power generating activities at the plant. And so our HIA was really intended to increase community involvement in the planning process for sampling the plant to see what contaminants had been emitted over the years, and to put into place a remediation plan. And all of this was being done as part of a consent decree that had been negotiated between the Pepco plant owners and the DC government. So they entered into a legal agreement to sample and to plan. And a community advisory group kind of sprung up out of the process. And our collaborative pushed very hard to have the community advisory group created. And then many of our members ended up populating the community advisory group. And if you were at the earlier session, Gwendolyn Honeycutt, who represents Kingman Park and who's a member of the community advisory group, was talking about her experience with this process. So we put together a team to conduct the HIA that really grew out of these listening sessions, grew out of the priorities that the community had brought to our attention and that we wanted to work on in some way, but didn't have a really clear picture of how to work on it. But one thing was clear, was that health was the driving concern for the people who were living within a mile of these facilities. And there were a lot of these facilities. So 2 Superfund sites, the coal-fired power plant, and then a bunch of other kind of more lightly polluting facilities, but all involving 4 or 5 neighborhoods in Northeast Washington. So Kingman Park, River Terrace, Kenilworth Parkside, Deanwood, and Eastland Gardens were kind of all of the neighborhoods. And really, they're all within spitting distance of the plant, but they're also within spitting distance of the 2 Superfund sites and within spitting distance of these other facilities, and kind of, you know, with highways running through them, and kind of within spitting distance of everything that the city had thrown away. And that's how I like to put it. So the neighborhoods were characterized really by being more than 90% African American, in contrast to the rest of the city. And this gives you an idea of the footprint of the plant. So this is what you see on the left-hand side. That's what you see when you ride the Orange Line through, or if you drive down Benning Road. You see the stacks. And the stacks are actually in the process of being dismantled and brought down as part of the recommissioning of the facility. And that process began about 6 months ago, and it's ongoing. This is a bird's eye view of the facility, and this is the Anacostia River, which really runs right along the plant. And so a lot of the chemicals that were used in the power generating portions of the plant have ended up in the river, and the river has been sampled numerous times, and there are lots of toxic hotspots in the river. And what Ms. Honeycutt was trying to illustrate this morning was that the consent decree that was negotiated between the city and Pepco required them to sample the plant itself. So this is kind of an overview of the plant itself, and to sample the river, but not anything beyond that, right? You know, it really stops there. So it stops at the fence line of the plant, not a single sample beyond the fence line of the plant. And then just this section of the river that most closely abuts the facility. So that's the extent of the sampling that's planned. So if you kind of come out a little bit further, you know, if you're a bird and you fly a little higher, then that gives you the ability to kind of see the surrounding neighborhood. So this is River Terrace, and Kingman Park is right here. Kenilworth Parkside is there in the upper left-hand corner. And then it's a very densely populated neighborhood to the east of this. So there are about 33,000 people who live within a mile and a half of this facility. And Kenilworth Parkside houses the landfill, which is, you know, on the NPL list. And then just a little bit further down the river here is the Washington Navy Yard, which is the other Superfund site that we can boast of. And so this is kind of a more graphical presentation that I like to show. And then the box contains some of the demographic characteristics of the neighborhood. So really a very high African American population. And in addition to that, I think, you know, a high population of women of childbearing age, the elderly, and young children. And I think it's noteworthy that, you know, you have a number of elementary schools that are kind of in the neighborhoods that surround the plant. But in addition, there's an elderly housing complex that is within a block of the fence for the plant. And, you know, it just, you know, that's kind of the nature of the beast. And there are no barricades or anything to separate these operations from the neighborhoods that surround them. So what we thought, and I've talked about this process, what we thought we would do is conduct the HIA as a way of really increasing the community's capacity to engage. Because everyone was concerned about health, but there wasn't anyone necessarily who was charged with the responsibility of making those health and environment connections. And so we thought, well, let's make them, or at least attempt to make them, and part of what we can do in that process is to encourage the local authorities to create some connections, say between the environmental department and the health department, to kind of take a look at what some of the potential health impacts may be. And we've had mixed success, I'd say, with doing that. The process was really encouraged by the city council woman who chairs the Environment Committee, who really has been very forward-thinking, has been able to introduce and have enacted into legislation lots of forward-thinking bills that are focused on environmental health in creative ways, looking at foods that are served in schools, you know, looking at improving environmental quality. Unfortunately, she lives in a different part of the city, okay? And the health committee is chaired by a woman who is relatively inexperienced, I'd say. She just assumed chairmanship of the health, but all of these facilities are in her district. So you kind of got this classic silo issue, because here we have a young chairperson who's trying to kind of, you know, carve out some territory, and all of these facilities are in her district, and the people who vote for her live in this district, but it's an environmental issue, and she doesn't have kind of direct control over the Environment Committee or the department that would be charged with this. So, you know, getting those folks to kind of play in the same sandbox has been very challenging. Mm-hmm. The other thing that's been challenging is no money. We've had no money, virtually no money. I mean, I was able to raise a $5,000 grant and hired a student for 6 months to work on this, and that was a joy. But that 6 months was really quite some time ago. Mm-hmm. So since then, we've been really, you know, doing all of this on a shoestring. And trying to get data. Someone asked the question about data, you know, what information is available to answer these questions you might have about the impact of this policy. And for us, the policy was the study of the contamination of the plant and trying to expand that to include people and not just the fish in the Anacostia River and the water quality of the Anacostia River, but maybe the health of the people who are living next to the plant. That we're really trying to kind of expand the concept of health that was described in the consent decree. And the consent decree very narrowly described health as the health of the workers who work for PEPCO, and the health of the fish, and the health of any people who are eating the fish in the river, and nothing else. So it's a very, very, very tiny health assessment, and we wanted a much broader health assessment, but had no money to pay for it. So Pepco, of course, has an environmental services contractor, Ecom, and they're writing very large checks to them to conduct this assessment. And they have done an excellent job of sampling. And we have a lot of data that we are trying to interpret. And they've sampled the PCBs, the PAHs, the metals on the plant itself and also in the river. But again, as I say, nothing in the neighborhood surrounding. So what we've done is we've tried to take that information and extrapolate. And then we've also looked at data that was collected health data that was collected in the city that's been disaggregated by ward and by zip code, and then tried to overlay that information and draw some assumptions and conclusions and make some recommendations about what ought to be done in terms of the cleanup of the plant. Now, our recommendations have also included I won't call it reparations, but suggestions for Pepco in terms of things that they could do to give back to the neighborhood for having been such a poor neighbor for such a long time. Recognizing that the consent decree doesn't focus on any of the air quality issues that may have resulted from this being a coal-fired power plant for 83 years, but is more of a forward-looking thing. But still, it was a coal-fired power plant for more than 83 years, and so you have people still living in the neighborhood who have been there or their parents have been there through that time period, and they would really like to see Pepco work with them to put some improvements back into the community to kind of compensate the community. Not individuals per se, but to compensate the community for the harm that was done from having to live so close to such a noxious facility for so long when it's so clear what the health effects of that, can and probably were. So that's been part of what we've struggled with as an advisory group and part of why we're still working on the HIA. The data's been very difficult to come by. The city actually doesn't do a very good job of collecting health information. It does do self-reports, though there's a lot of data from a data set called the BRFSS, which is basically self-reports of health problems that people may have that are collected in the school system. But the city hasn't devoted the attention or the resources to really collecting good health data. I mean, we have vital statistics, deaths, and the hospitals have information. And actually the best information the Children's Hospital has, because there's one children's hospital, almost every pediatrician in the city is affiliated with that children's hospital, and they have a pretty good database. So for children's health outcomes, we can get pretty good information. But for some of the health outcomes that affect adults, for example, we can't really get good health information that is disaggregated at the neighborhood. So I guess my take-home message is you have to take the data as it comes and do the best you can with the information that's available. And if you have the luxury of some funding or an agency that has a budget that you can use, then you're good to go. You could go out and do some data collection, but you often don't have that luxury. And so what you have to do is work with existing databases and kind of patch it together as best you can, but try to do it in a credible way and build. The one area where we have been able to do some data collection is we put together a survey. Everybody who was working with our collaborative weighed in on the questions. I was able to commission a website. You can actually do that fairly cheaply and use a survey instrument tool. And we had a database of telephone numbers that had been used in the last political campaign. So we did robocalling. And then when people left a message, they would be directed to log into a website and they could fill out our survey and at least give us some information about what health concerns they had experienced, how long they had lived in the neighborhood, how close they lived to the plant, whether relatives in the household had health concerns, what those health concerns were. So we've been collecting quite a bit of information in that manner. Now, one downfall, of course, is that about 20% of the households had web connectivity when we began. So that meant 4 out of 5 surveys had to be done over the phone. So it's been a very labor-intensive process, and really it's been me doing most of those calls because I no longer have staff, and I couldn't really delegate that to volunteers because I had to make sure it was done in a fairly consistent manner and that it met my IRB requirements, so that basically meant that I had to do it. So this is how I spend my nights and weekends, is on the phone. Institutional Review Board had to approve the design of this study. So that meant I had to tell them, how it was going to be done, get approval for the instruments, and assure them that it would be done in a consistent manner, and tell them who was going to be working on it. So the who, ended up really being me after the first 6 months. And it was me and a student, initially. So it's taken a long time. It's been difficult to get the information, but it's been a wonderful exercise in terms of helping to move PEPCO off the dime, because had we not begun and had we not started talking about conducting our own study, they would not have opened up their study process to community members. The CAG would never have been formed. And the CAG has been a wonderful lever to use. So we can go down to the city council and say we're CAG members and ask to meet with people and really kind of shine a light on what's going on. And it's giving us, the CAG is populated by people who run civic associations in the neighborhood, like Friends of Camden Park, for example. And so this gives them an opportunity to get the information and feed it back to people in the neighborhoods. Now, the translation process has not been easy. I hired a toxicologist to work with our group just to help me with the translation issues, because the data is really very dense. People don't understand what these chemicals do, what the health effects are, how they migrate, how persistent they are. These are all questions that it has to be digested and fed back in such a way that it's understandable for people and that it doesn't frighten them away. So I needed help doing that, and we've been able to bring in some technical expertise to help us do that. The next step, which is kind of and I'm gonna wind up, I know I'm running long. The next step is the section of the HIA where you kind of report back to your constituency, but also to the policymakers who are considering your proposed project, the thing that your HIA is focusing on. That step for us will probably involve local media, as well as the organizations in the neighborhoods who are affected. So we'll start with the civic associations, and DC has these entities called area neighborhood commissions, and they are elected officials who represent kind of a small segment of a neighborhood. And some of those folks are involved. So we'll start there and really, just talk about it, send out the drafts, have neighborhood meetings, have people talk about it, get feedback, rewrite it. We've been kind of in that iterative process of rewriting and rewriting and rewriting for a while, but that's our way of getting the information out. So because for us, it's the communication portion of this is perhaps more important than what actually happens to the policy, because we don't have direct control over what happens to the policy. And in a way, the city and PEPCO kind of got together in a back room without talking to any of the neighborhood people and decided what the policy was going to be before we ever came to the table. Now, we will be able to, I think, influence what the remediation turns out to be. So after the sampling is done, a plan has to be devised. And we've been so noisy and so visible that we now actually will have a seat at the table in helping to design the plan. So our HIA has been successful, even though it's not yet finished, because it has created a very prominent and important role for people living in the neighborhoods, and it has helped to raise the awareness about the toxic exposures of the plant in a way that could not otherwise have been done. So, if your HIA only does that, then I think it's really been a very, very useful tool, regardless of whether it meets the specific criteria that are outlined for what a good HIA is. And I suspect ours doesn't, to be honest. But in the way that we designed it, I think we felt that it was effective. So I don't know if I went through my slides, I probably didn't. But that's okay. I'm done. Okay.
People have questions for Janet? I have a couple of comments to make. Yeah, go
Is
ahead.
that
Dottie?
PowerPoint available? Is that PowerPoint going to be put
Oh,
somewhere?
yeah, I'll send it. I don't know what's happening with the PowerPoints for the conference, but I brought cards, and I'll be happy to send
I
it to
would
you.
love to talk to you, like, your
Sure.
situation really similarly mirrors what I'm working with, in terms of what's going on. There's 2 brownfields, two Superfunds, one's on the national priority list. This is a brownfield that they want to convert into a more intensive operation. You have, a coal-fired power plant, you have, another, Mount
Concrete
Air, concrete plant, Mount Air, rendering, hatchery, poultry processing, Merck Pharmaceutical, all within 2 miles.
The 2 schools.
And 2, yeah, 2,
Elementary.
elementary and middle. And no one, as part of the remediation, has gone off the site of the property to do any testing. The community ourselves, we had to pay for some water testing where we found contaminants that were on the brownfield in the water wells. And it's a real, I know that you would probably be able to guide us in how we can, Governor's
I'd
Pet
love to help
Project.
if I can.
Yeah.
We'll talk offline.
Thank you,
Okay.
thank you.
Dottie had a question.
I was just going to underscore one of the really important points that Dr. Phoenix made, that the current consent decree requires this study, but it does not, and then all the parties will come back, and by all the parties, I mean the District Department of the Environment and PEPCO will come back and negotiate another consent decree for actual cleanup, because this current, PEPCO is under no current consent decree to actually remediate anything that they find from the study they are doing, which is, makes me want to set myself on fire, so it's cool, great to hear about this HIA, because that can go really wrong way, I am imagining. I mean, you were essentially teeing up for that.
Yeah, basically.
Essentially, right?
Yeah.
Yeah, I'm hearing an interesting common theme. So does somebody have the thick HIA for CSX that I sent around, the one that says intermodal rail facility? So this story, which unfortunately you're not going to hear firsthand, is the speaker who's missing today. But let me just tie together something you said, what she would have said about this process, because I've actually had people from Laurel Park come and speak to other groups. And also this story that I was talking about in LA. In all 3 cases, the common theme is a mechanism for engaging community members in an inquiry process that then gives them something to talk about to people in power. And then they change the agenda as a result. So you're changing the agenda by saying you have to think about the impacts beyond the footprint and the defined space. These people got their HIA and they went to their city council in Baltimore City. This is Morrill Park community in West Baltimore, where a rail facility was planned. And it was a done deal. I mean, it actually breaks all the rules about HIA because they were told this was going to happen. CSX was going to come and create this new rail facility in their backyard. Residential community, West Baltimore, middle income, they were used to the rail lines being there, but now they were going to have a lot more activity, truck traffic and rail cars. And they took the results of this health impact assessment, which says if you're going to do this, it doesn't say you shouldn't do this, it says if you're going to do this, then you need to do all these things to mitigate the air pollution that's going to be increased in this residential neighborhood. They took it to the city council in Baltimore City, and they took it to their councilman rather, and then they also went to Annapolis. And it was that activism, which you're describing with your community advisory group, right, your CAG.
Yeah, your CAG.
And which these people also, you can, in this paper, you can read about how these Los Angeles communities started going to all the meetings that the port and the Department of Transportation were having. It's that's what you really use the health impact assessment to do, is to start a conversation with people and change what they're thinking.
Why Annapolis? What was in Annapolis?
They wanted to engage the State Department of Transportation.
Okay, the
So
Department of
they needed
Transportation,
to
okay, I
say,
didn't
if you're
understand what was
if you're
there.
gonna let CSX do this to the rail lines in our backyard, then we want protections. And I didn't tell you, the end of the story on this one was CSX said, we're packing up and going home. We're not building this thing. Too much trouble. We don't want to try to build it. So they won. It wasn't the intention of the process to close it down, but it ended up closing down the whole proposal. So I don't know, Katie, if you want to comment on that at all, do you have any observations from being also a Baltimore City person?
Oh, no, I
No.
think that, I mean, I think you did a good job summarizing. Yeah, it was interesting. I mean, when I started last year, it was still kind of ongoing discussion there. So it was surprising when CSX just completely pulled out of the site.
And with Pepco, you've got an interesting, what Dottie's saying about the next shoe to drop is where you'll really try to influence.
Yeah, next year is going to be interesting. Any other questions for me? Okay. Okay, so we can
Do you
transition.
want to do the exercise, or do you want me to? Want me to
Oh.
explain this? So we have a couple of pages that we copied out of this book called A Guide for Health Impact Assessment that we were recommending. And gives you, well, I'm passing it out, but you just describe it a little bit.
Sure. So we thought it might be nice if you left here with a better understanding of one of the early steps of conducting an HIA. And really, one of the earliest steps is the screening, which is an effort to really determine whether you have in place the necessary elements to conduct an HIA. So we put a handout together. So the first page really kind of talks about some of the questions you should ask before you agree to engage in the HIA. So are there potentially significant health effects associated with the alternative? So if it's a policy that's being considered, or a program, or in the case of the CSX, it was a facility that was going to be sited in a community. So whatever the decision is, does it affect health? And one thing I should emphasize is that technically, if health folks are working on it, it's not an HIA. It sounds a little paradoxical, but the tool is intended to help inject an assessment of health or an evaluation of potential health consequences into a policy that is not health related directly. So if you're talking about, hospital or Medicaid facilities, that's not an HIA. It's something else that isn't health related that allows you to look at the potential health impacts of that or the health effects of that. So that's what it's intended to do. So that means generally it's going to start with people who don't necessarily have the health expertise or who aren't necessarily housed in your health agencies, but you do need health expertise in order to bring it about. So it really requires what we call that inner silo work, bringing different disciplines together to conduct it. And so you need to have different disciplines in the room when you begin the discussion about whether or not it can be done or it should be done. So, and then the other issue is the health inequity portion of this, which is really a pretty critical piece. And one of the neat things about HIA, because it's one of the few tools that is grounded and gives you permission, explicit permission, to look at inequities and to look at whether certain communities or certain populations are going to be more adversely affected than others. So that's another thing that you need to kind of talk through as you're going through the process. And then are these well understood or are they hidden? So will your HIA accomplish something by illuminating something or revealing something or better clarifying something that wouldn't otherwise be clarified if you didn't do it?
So Janet, does that mean if you were picking a topic where it's really already obvious that it's got health problems, that you wouldn't want to do an HIA?
I think that's the recommendation, that if the health impacts are already pretty clear, if there's data or information available that kind of outlines those very clearly, in terms of the policy or the project that's being considered, then you don't really need to do the HIA. But most of the time, that's not going to be the case, I suspect. And then, are there alternatives that could be considered that have differing health effects? So can you have an A, B, C, can you outline options for the decision makers that they can consider with your HIA? Give them a place to go, in other words, and not just, throw stones at a particular proposed project or policy. And then the feasibility piece is really pretty critical. I mean, if we had really, we kind of leapt over the feasibility piece and dove in anyway because we were committed to doing it, but really we did not have the available data. We are still compiling the data, and part of our struggle has been that we have to rely on data that's being generated by the people who we really are struggling with. I mean, the study is being done by PEPCO, being paid for by PEPCO. The data is coming from their environmental services contractor, and we're not even sure whether we should believe it or not. So we've been trying to get an independent person to assess their data. So you do really need to think about whether the information is available to answer the questions that you're going to pose. So it's research that you're doing. You're asking a set of questions about an association between health and this proposed policy, but where are you going to go to find the answers to those questions? And then who's in the room who can assist you with that? That's really, and then the last part, of course, is how much of an influence can you have? And it sounds like in the case of oftentimes I think communities take on challenges that researchers probably wouldn't take on because, we're very, cerebral in the research community, and we might say, oh, well, there's no point in even pursuing this line of questioning because there isn't enough information, and then, the decision is probably already hardwired, so why beat your heads against the wall? But if you're living in a place where your health or the health of your children is threatened, then sometimes you'll go ahead and take that step, and it's almost like if you build it, it will come. I mean, people came out of the woodworks to help us who we didn't know were there initially. People in the neighborhood who ended up having expertise that just, we had a statistician who showed up at one of the meetings who had an infant daughter who lived within 1.5 miles of the plant, and he did our demographic analysis. I mean, it happened, and it gained momentum. And once it gained momentum, some of these hurdles were more easily overcome. But you at least need to, thoughtfully walk yourself through the process. So that's page 1. So what we'd like to do, I think, and I'm not exactly sure how we'd like you to do that, and Rebecca, I'm going to turn this back to you, but we want to try to walk you through an exercise where you, perhaps using a proposed policy or program from your own experience, can walk through the exercises on the page that's marked 13 at the bottom and answer these questions and kind of get into the thinking, put your HIA thinking caps on and kind of start doing it, basically.
So I actually thought, since Maria said, look, her eyes were glistening and her ears were opening up, I thought maybe you could describe briefly what was going through your mind about the applicability of this, and we could use that as a case, and as a group, talk through whether your case in mind, how it stacks up against these questions. Are you up for that?
Yes.
Are you willing to come up and talk to us a little bit about the situation that you had in mind?
So you want me to
Put you
go
on the-
through, you want me to go through this situation to see if it's,
I just
Well-
want you to describe the threat that you're thinking of right now that might be suitable to this
Okay.
analysis.
Well,
Just
what-
maybe a few words.
Why don't you use the mic? Okay.
Yeah, you
well-
can come stand here.
And what I'm thinking is, okay, it sounds like very similar that the environmental team and like PEPCO are kind of, seems like this is a politically,
Charge.
yeah, this is a governor's pet project. This was supposed to be starting production next month. For 18 months, I have held them back, but it's like legally, and now we need to go beyond it.
And
But they
it's
had
a
to do,
slaughterhouse?
it's a slaughterhouse. It was a seasonal,
It was a seasonal Vlasic pickle plant. This went back to like 1975, and it was in a heavy industrial zone. There was like these spot communities that were in place. Jay lives in one of them directly across the street. Shallow wells, 50 feet. And then what happened a couple years ago with Sussex County, you had, you know, your beach traffic coming in, Rehoboth Beach, Bethany Beach, Lewis. So now they're putting in, you know, waterfront townhomes on the one side of the street, and they're annexing, so they have public water and sewer, and on the opposite side of the street is the minority community living in, you know, trailer park, and asking me, how come they get public water and sewer, and we're drinking water that's contaminated? And we all know the answer, and Jamal knows the answer, you know?
But
for the purpose of this.
illustrating this tool.
Okay.
Let's take the let's say that we're going to assess the slaughterhouse proposal specifically.
Right.
Can we do that? And the first question is, does the decision have the potential to affect, directly or indirectly, health outcomes via environmental or social determinants of health?
Absolutely.
See if I can change this.
Okay, no, that's right.
situation here.
Yes, absolutely, because what they're intending to do is to discharge the water into the Indian River, which firstly, they should not even be able to do. You're not allowed discharges. They tried to transfer an expired permit, which I had to call up David McGuigan at Region 3 and say, Dave, look, hey, they're trying to, and he stopped that. You can't do that. So my thinking is that to get an NPDES permit here is going to be very costly, and they're going to have a lot of offsets. Mount Air, the other facility that's within 2 miles, they had to buy thousands of acres to land apply there.
So is the drinking water for the people who were already there, you know, before Yabbyville?
Well water,
sprung
yep.
up, right, so they're drinking well water.
Mhm.
So the discharges could potentially affect the water that they're
Right.
drinking.
I actually have documents from the DENREC, their environmental agency, like MDE or DEP, for the Vlasic facility from 1991. They knew that there was a plume of contamination traveling to the shallow drinking waters. They never told anybody in that community, ever. That was since 91.
So
Yes.
you've got some evidence, it sounds
Oh,
like.
yeah. The problem is, it's like the first really unbiased person was in the local appeal where we finally got it in front of a judge. And the judge's, literally, his comments during, we're waiting on his ruling, were, hey, look, when they want to put a cell tower in here, they do a health impact assessment, a traffic study. Are you telling me that John Hopkins Center for a Livable Future, I got them to send in comments, sent in this, and no one addressed these? No one did an impact? You know, so the judge was like, kind of like, but it's a pet project, to the point where the governor was literally door knocking himself with the state representative that we just put out in the community. This is how political. How many governors have you seen door knocking with the candidate who is currently up on domestic abuse, DUW? Okay, so yeah, it's
Which governor was this? What's in
This is
Delaware?
in Delaware.
Governor Markell. It wasn't the representative was John Atkins. John Atkins has a pretty rough type of history.
Is
Let
this
me-
still in? Oh, okay.
Now we got a worse one, but
Let me
the
try and
message
pull
was
this
sent.
away. You've given us a great snapshot of a real life circumstance that you're
Mhm.
fighting. Let's try to pull this away from the specifics to a generic
Generic.
proposal of a slaughterhouse in your community, okay? And try to imagine how you would go through some of these questions. I mean, you can pick out anything you want, but what comes up for you in imagining a slaughterhouse in your community? And actually, Jay, you should be able to answer this.
Yeah, well,
especially.
you know, water quality, number one, air quality. I
Air
mean, you're
quality.
talking flies, you're talking rats, you're talking, we call stormwater runoff, you know.
So attraction of pests,
Yeah,
well water quality, you talked about well water, but also storm water. Those are two different things.
Truck traffic.
truck traffic.
We have the studies from Hopkins that they sent in testimony on
Okay.
MRSA, you know, from the poultry trucks. I'm not sure if you're aware, they did a study
Yeah.
following poultry trucks.
Oh, huh.
I mean, what do you call it, the other poultry processing plant that's like 2 miles away, it's the #1 polluter in the state of methane gas, which is a greenhouse gas.
Because of the
And-
waste?
Yes.
From the waste.
And now they want to put another poultry processing plant producing the same amount of chickens, which probably in effect will create the same amount of methane gas in the area. With the 2 schools right in the middle, and you're going to basically double the amount, and, you know, if this plant ever comes to be.
So I guess for me, you know, I think you have to use the handle that is easiest to grasp. And the well water connection to the chemicals that the slaughterhouse is going to be discharging, to me, that's the low-hanging fruit. Because, you know, it's so clear that consuming contaminated water has a direct link to health effects. So to the extent that you could say, you know, da-da-da-da-da-da-da in terms of the chemicals that are going to be in the well water, and then here are the health effects from drinking water contaminated with these chemicals. And to me,
I
that's
see
the
what you're
low-hanging
saying.
fruit.
Yeah.
The
I see what you're
methane,
saying.
you know, I think it's a harder lift. It's not less important, but it's just, the story is harder to tell, I think. So you want to go with something that's really compelling, easy to capsulize for people. You know, if you could put it in a soundbite kind of thing, that's kind of your,
And I think
I would
that's
focus on
very
that.
interesting. So Dr. Phoenix is illustrating actually another piece of this, which is proper scoping. You don't have to take on everything about the proposal, right? You can decide that the scoping is, what will the slaughterhouse do to our well water?
yeah.
That would be an example of a scoping choice, I think, right?
Yeah,
Am I right?
absolutely.
And you just said there's a strategic reason to do that,
Yeah.
because it's very direct impact on people, and we know what contamination of
Yeah,
water
the
has done in
evidence is
other
more
places.
clear, I think, there.
Okay, let me give you a counter, what they're
Okay.
saying, okay?
Okay.
Because this may or may not come into play. All that we keep hearing their soundbite is, we're gonna invest $100 million into this new technology, so the water is going to be cleaner than when it comes out of the ground.
Yeah, sure. New technology, so unproven, right?
Wait, yeah, you want to
Yes.
see the technology in action.
Yes.
Yeah.
Yeah.
So
Well,
what's the
they
evidence
stopped
that
the,
will work?
the other poultry plant from discharging into the river because of the quality of the water.
Right, they need the
There's
5,000.
also a wastewater, or waste treatment plant right there in like less than a mile from this plant. And they were dumping in the river, and they stopped them from dumping in the river. But what we can't get an answer from them, if you're gonna stop all these other places from dumping in the river, why would you allow the South Korean plant come here and dump in the river?
Instead, yeah, yeah.
And it still comes down to the water,
The
right
water
there.
will be cleaner than when it comes out of the ground. Yeah, really.
Yeah, easy promises. We're out of time, I can tell, because
Darn.
people are starting to arrive for the next session. So I hate to stop us there, but thank you for letting us borrow your example. And I hope that you'll give us your cards or come and get my card if you want some of this information. Katie and Dr. Phoenix are both willing to
Definitely.
provide more information. We'll stick around for a few minutes.